Hi, my name's John Derse. I'm a senior partner with Mercer, and I also lead Mercer's healthcare industry consulting here in the United States. We have been conducting a spot poll survey for the last 4 weeks, looking at challenges and changes to human resource policies and programs as a result of COVID-19. I want to share with you just in the next few minutes some of the highlights of what we've seen, and this is interesting, and I hope you agree. What I want to share is some observations around pay, in this case primarily hazard pay, some changes that we're seeing related to benefits, benefit treatment, and then a few changes with regard to the workforce staffing and staffing mix. So let's dive in. With regard to pay, as I said, most of the focus has been on hazard pay. This is hazard pay as it relates to COVID-19 and activities related to that. We are still at a point as of today, April 10th, where the majority of respondents are not now paying hazard pay, meaning in this case, we've got over 80% that are not making hazard pay a possibility for their workforce, and 20% are. Of those that responded that are considering it at some point in the future, if they were to make hazard pay part of their program, 92% felt that they would be directing that for sure at nurses, and another 50% said that they would be directing that also toward respiratory therapists, lab technicians, and environmental services. Now, this is a moving target, as you might expect, so stay tuned. Hospitals are continuing to have the financial challenges as a result of postponing so many of the elective procedures, and there's also potential movement coming from the federal government with regard to grants or making some allowances for hazard pay. So this is where we are as of today, April 10th. The majority are not currently paying, but it is something that's on the move. Let's move toward benefits. Employee benefits, there are 3 observations that I think we would find interesting. The first one is around child care. Most of the organizations that responded are not currently anticipating changing their benefit policy or program to allow for and account for dependent child care expenses. However, over 50% of the respondents are helping the workforce to find off-site alternatives for dependent care as a result of COVID-19. On the eligibility periods, also 86% of the respondents are not yet adjusting any eligibility periods. Eligibility period is the time from when a new hire joins an organization until benefits become eligible. And right now there's no change, or rather there's very little change from 86% of those responding. And when it comes to the third area of the treatment for COVID-19 related expenses for healthcare workers, at this point, nearly 2/3 of the respondents are now paying for these expenses with no deductible and at 100%. So again, for over 60% of the respondents, they are paying the expenses for COVID-19 related healthcare expenses for healthcare workers at 100% and no deductible. With regard to the workforce, there are a couple interesting developments there. This is an obvious point, but 86% of the respondents are currently actively reallocating staff. This is moving staff from one end of the hospital to another, primarily to adjust for patient volumes and some staffing changes. There are 76% of the respondents are increasing their use of per diem nurses, and there is, in over half of the respondents, an active staffing and team change to account for experienced nurses being teamed with inexperienced nurses. This is from a safety perspective primarily. And finally, 41% of those respondents are working with local hotels and other providers to account for and make allowance for individuals that are separated from their families as a result of COVID-19 in terms of additional hours or fear of being exposed and not wanting to expose the family. So again, this is a moving target, which we will be tracking each week. But at this point, 41%, just less than half, are actively working with local providers, local hotels and other items like them to provide for care and hospitality. So as I close, just to recap, this is where we were after 4 weeks of a spot poll. These are just the highlights, but these are all on the move. We will continue to work these each week, and hope that you will stay tuned, and we'll be back and share results soon. Thank you.